My name is Peter Johannsen. I'm a neurologist by training and been working with Alzheimer's disease for more than 30 years. For the last 6 years, I've been employed by Novo Nordisk at the global headquarters, taking care of the scientific content when we test medicines in Alzheimer's disease. Novo Nordisk is providing funding for Predictome, but also project management.
So my name is Dag Aarsland. I'm a professor of audit psychiatry at King's College London, and I am the academic PI of Predictome, which is a great pleasure. My key activities is in the clinical part of it, the clinical data collection. I worked with a team of researchers across Europe, many different centers, to recruit and collect data on participants. So the disease unfortunately has severe consequences. So that reduces the cognitive functioning, the social functioning, brings a lot of emotional and behavioral changes, and in the end also basic functional motor capacity. So it's a devastating disease. We have some drugs available. In addition to medications, there's also a lot of support activities that needs to be implemented. And the earlier these interventions can start, the better is the prognosis.
Alzheimer's disease and other types of dementia can be really difficult to diagnose very early on, mostly because many of the symptoms are vague, and the symptoms can be due to other things. So that's why it can go unnoticed for a long time. An early diagnosis of Alzheimer's disease or other types of dementia are really important, not only to the patient themselves, but also to the family. Without a diagnosis, there's no treatment. It's also important for the patient to be able to make the decisions by themselves, to choose what they want in a stage when they are able to do so. So all research shows that the earlier you get the diagnosis, the better your course will actually be. The aim of Predictome is to try to find methods to do an accurate diagnosis early on. That's so-called biomarkers. Biomarkers can be something you measure in the blood, or it can be a kind of a brain scan that tells you whether this is Alzheimer's disease or not. And Predictome is at the forefront of the research of how to actually diagnose in an easy way, and also maybe even at your general practitioner.
Every disease is hard to diagnose early, but the positive development is that we have very, very good biomarkers these days. So what Predictome is about is to see whether these new technologies can be implemented, not in the hospitals, but with primary care physicians and even in people's homes.
Collaboration is so important when you develop new methods how to diagnose. It is really complex, and it takes a lot of different companies, but also academic and university research, so that you assure that you also get the patient perspective, the perspective of the doctor, and of those companies that are to help build the technologies that are needed.
The most important thing, in addition to early detection, is better treatments and hopefully prevention. And that the data that Predictome provides are a core element in terms of early detection, so that prevention can be targeted to the right people.
In 10 years, I foresee that the diagnosis will be easier, more accessible across countries, and it will also lead to easier treatment. There are now treatments also approved in the European Union that can change the course of Alzheimer's disease. 10 years from now, we will have more treatments for sure, and we can actually change the course of patients with Alzheimer's disease.